All right, we're going to look at chapter 11, the digestive system, often called the gastrointestinal system. We'll look at some of the terms that we use, a little bit of an overview. Again, often called the gastrointestinal system. It's made up of a digestive tract, also known as the GI tract, and it has several structures and functions. It processes and transports nutrients and various waste. So it's going to break down nutrients and then eliminate. The alimentary canal is tube or tract formed by the GI organs. So what we refer to as intestines, but you need some help there with other organs to break down in the intestines. The canal extends from the mouth to the anus. So when we talk about GI system, it could encompass part of our like dentation, our teeth, starting in the mouth where saliva starts to break down a food. So mouth, pharynx, esophagus, stomach, intestines. Here's a little picture kind of showing you some of the organs that also help. So after entering the mouth, it's the food is going to, or liquid goes down the esophagus into the stomach, which has a fundus at the top, and down at the bottom a pyloric sphincter, which is going to push that food through to the duodenum, and then the duodenum is the start of the intestine. And so we start with the duodenum, ileum, and then the colon. We also have the liver, the gallbladder, the pancreas, that's going to help break down food and send liquids or bile over into the intestinal area to start the breakdown. When we look at digestion, it's the process of breaking down food by starting out with chewing and then swallowing. And then it mixes with digestive juices to convert some of that food into molecules that can be absorbed. It also will absorb food molecules through the walls of the intestine and into the bloodstream. So this is where you get your nutrients. And then it's going to eliminate or excrete the non-absorbable nutrients and waste from the body. So there's going to be things that don't need to be, we say, taken up by the intestines. So starting with the juices and the saliva from breaking down, then the stomach is going to have several acidic juices that will help break down, converting some of that into the molecules. And the absorption takes place in the intestine. So oftentimes when we have people that have a intestinal issue or has had part of their intestines removed, they have some absorption issue with getting enough calories or nutrients. And so we have to use types of supplements, sometimes intravenous nutrients. And then it's absorbed in the intestine, carried through to the bloodstream, to the cells of the body. And then excretion is going to be where we eliminate the waste, the products that are not needed for absorption, and which are eliminated via the rectum. So when we look at some of our terms, bile or coli is bile, so biogenic, pertaining to the bile, and coli refers to here it's bile, but you will see it's also refers to gallbladder. So lith would be stones, and then pertaining to stones in the gallbladder is what cholelithiasis would be. Bucco means cheek, and then buccal is pertaining to the cheek. Chylo, or some people say chilo, but it's pronounced chylo is the lip. So chyloplasty is to have like reconstructive surgery on the lip, some often seen from injury. Abdomino, celio, and laparo is abdomen. So laparo is a lapar. It depends on how you pronounce it, but when you put it together with a suffix like the laparoscopy, then you can see pronunciation will change. Celiac, pertaining to, and then abdomino, centesis. Centesis would be where we put in a needle and draw out fluid, remove fluid. Ano, anus, so anal, pertaining to the anus. Appendico, or when we say singular, it's appendix, and appendical would be pertaining to the appendix. Colo or colonal is colon, so inflammation of the colon, and then a scope, colonoscopy. It's very important that we know that we're spelling correctly and that we're emphasizing the suffix. So if you said colonoscopy, it's using a scope to look into. But if you said colonostomy, it would be where you put a hole in the colon or incision into the colon. So colostomy is a lot different than a colonoscopy, but sometimes people say it fast, you're not sure what they said. Cysto is bladder or sac. So cholecystectomy would be the gallbladder sac is removed. The chole meaning gallbladder, and then the actual cysto is the bladder or sac. And then denti refers to the teeth, dental. Doco is duct, choledochotomy. So this would be where, again, referring to the gallbladder. We have a lot of terms referring to the chole duct, and that would be incision into. Duodenal is duodenum, part of the intestine, the start. Entero is the small intestine. Interocele would be like the like a blinded pouch. Esophagus, pertaining to esophageal. Gastro is stomach. So gastritis, specifically that bladder sac looking stomach, versus a lot of people say gastritis, so if they just have inflammation of anything in the GI tract. Gingivo is gum, so gingivitis, inflammation. Glosso or linguo is tongue, glossitis and lingual, so pertaining to the tongue or inflammation of. Hepatic O is liver. Hepatomegaly, enlarged liver. Hepaticotomy would be incision into, cutting into that liver. Hernia O is a hernia, herniophory. So that means that if somebody has a hernia, we might be looking at repairing that. Ileum, ileostomy would be cutting into and forming a hole or an incision, what we call stoma. Inguinal is a groin, inguinal. Jejunal referring to the jejunum, so it's going to be after the duodenum, part of the intestine. Jejunitis would be inflammation. Litho refers to stone, so lithiasis pertaining to stones, which we have stones in our gallbladder, stones in our kidneys. Oro or stomato is mouth. Pancreas, pancreatitis, which could be very painful inflammation of the pancreas. Perito is a peritoneum, peritonoscopy, be looking into the peritoneal cavity. Phago is to eat or swallow, so aphagia would be not being able to swallow. Procto is the anus or rectum, so proctologic is pertaining to the study of the anus or rectum. Pyloro is pylorus, the gatekeeper, which is the end of that stomach that's like the sphincter that opens and closes to empty the contents that are being broken down in the stomach into the duodenum. Recto is referring to the rectum. Celio is saliva, coelithiasis, so stones. Sigmoid colon, sigmoidoscopy, looking into the portion of the colon. And steto is fat, stetolysis. So sometimes we also have fat in certain parts of the body or breakdown of fat. And then steto would stand for that, as well as, remember we had lipido. Emesis is vomiting, so hematoemesis would be vomiting blood, hemato meaning blood. Some anatomic terms that we'll see or refer to that you'll hear us say would be like salivary glands would be the 3 pairs of the exocrine glands in the mouth that secrete saliva. It's the parotid, submandibular, and sublingual glands. And then the cheeks refer to the lateral walls of the mouth. The lips, the fleshy structure surrounding the mouth. The palate would be the roof of the mouth, divided into a hard and soft palate further back. The uvula would be that structure, that's a little small projection hanging from the posterior middle edge of the soft palate. Your tongue is a muscle structure at the floor of the mouth, and it has mucous membranes that cover it. And it's secured by a band-like membrane known as the frenulum underneath that. Kind of looks like a spider web. Gums are the tissue around the neck of the teeth, and you should have them in the upper lower jaws, also called gingiva. And then your teeth would be the hard bony projection in the jaws for masticating, which means chewing. In the stomach, we have the cardiac sphincter, which is part of the stomach. Again, a sphincter would be something, so like the kind of pushes through or has a muscle contraction to it. So the pyloric sphincter is opening from the stomach into the duodenum, And the cardiac is the lower esophageal sphincter, so it goes from the esophagus into the stomach. And sphincter means band when you're looking at medical terminology. So kind of gives, and it's very elastic. We'll look at what makes up the small intestine. It's duodenum, the jejunum, and the ileum. The duodenum is the first, obviously, second, and then third portion. The duodenum is where we also get the input coming from the bile, from the common bile duct coming off of the pancreas and gallbladder. The large intestine has a cecum, which is the first part of the intestine, and it has a variform appendix, which is a worm-like projection of lymphatic tissue hanging off the cecum, and really serves no purpose that they know of, but it does get inflamed, it can get abscess, and make somebody very sick. So we often do appendicitis, where that's inflammation of, and then we'll do an appendectomy, remove that appendix. Colon is a portion of the large intestine from the cecum to the rectum, and it's made up of what we call ascending, that extends upward from the cecum, transverse, extends across, so across going left to right, and then descending is a colon that extends downward from transverse colon, and then the sigmoid is going to be kind of an S-shaped one that terminates and goes down to the rectum. And then the rectum is the distal end of the large intestine, and then the opening of the rectum is the anus, where you're going to eliminate waste products. Feces is referred to as waste, formed by the absorption of water in the large intestine. It's usually solid, so often called stool, and when somebody has a bowel movement, that's the same thing as defecation, which is the evacuation of feces from the rectum. Peritoneum is the membrane surrounding the entire abdominal cavity, and it has a parietal layer and a visceral layer, so it helps protect the organs. Your liver is an organ that's in your right upper quadrant of your abdomen. It produces bile, which is secreted into the duodenum and helps digest and breaks down your food. Have to have that to live. Gallbladder is a receptacle that stores and concentrates the bile produced in the liver. We can live without that. Pancreas is a gland that secretes pancreatic juice into the duodenum via the pancreatic duct, where it mixes with bile to digest food. We also need that to survive. And then the biliary ducts are ducts that convey the bile, include the common hepatic, cystic, and common bile ducts. When we look at the abdomen and we're talking about it, we often break it up into, if we say quadrants, then it's 4 areas across what we call the umbilical region, which is your belly button. So that's an umbilicus, we're using medical terms. But if we're looking at regions, you can see that the regions would be made up of 9 areas. So like an epigastric region is right up under your sternum. And so when we're talking and we're dividing things up, it's important to know based off of where organs are. So right here, when we're looking at the quadrants, when we say your liver's in your right upper quadrant, typically you don't feel it because the ribs are there. But if you feel it, that's an indication there's an enlarged liver. Right lower quadrant, oftentimes when you press down and then let go, there's pain elicited, which means that you could have an inflamed appendix, or in a female, it could be ovaries. But often we see people that have their appendix on the left lower quadrant. So we always have to be aware of people being different. Not everybody's made the same. This kind of gives you an idea of how you see the where the gallbladder is, the stomach, and then the pancreas, which is kind of hidden back there. It's like a little telly, fatty organ. And then you can see there's a common bile duct, and then the gallbladder is very little, that little green sac there. And then those stones in there, that's the lithos. So cholelithiasis, this is a picture of that. You would have stones in the gallbladder. So sometimes they get stuck, and then that person has extreme pain and their skin turns yellow because the bile is not being excreted, and that term is referred to as jaundice because the bile is building up in the blood. Here's a picture showing you in the 4 quadrants what kind of condition it could be related to pain. So it's very hard. So you can see right upper quadrant, we said it could be inflammation, hepatitis, inflammation of the liver, but also we can have what we call referred pain, pneumonia, your lungs back in there too as well, or it could be a kidney. So we can't say for sure it's certain things, but it gives us an idea what is located where and what kind of pain we see in the abdomen. Certain terms that we also use: anorexia is loss of appetite, orexia is appetite, and meaning no. Aphasia and inability to swallow. Ascites is where we get accumulation of fluid in the peritoneal cavity, which is very rich in albumin, which is protein. Buccal is the cheek. Diarrhea is stool that's loose or liquid. Constipation is the infrequent or incomplete evacuation of your bowel movement. Constipo, it means to press together. Dyspepsia is refers to indigestion. Pepsia is digestion, difficulty, and this is actually where Pepsi first got their name when they originated, because it would make people regurgitate, or burp. Dysphagia is difficulty swallowing. Eructation is belching, so that would be burping. Flatulence is passing of gas, so flatus is blowing. So if you are farting, you have flatus, and you have flatulence. And halitosis is bad breath. Halitus is breath. Hematoemesis, emesis meaning vomiting. Hemata is blood, so vomiting blood. Hematochezia or chezia is red blood in the stool. Chezo is defecate. Hepatomegaly would be enlarged liver. Hyperbilirubinemia, so hyper meaning excessive, and then bilirubin, the bile pigment, and then emia would be in the blood. Icterus means a yellow discoloration of the sclera, the white of the eye, so it turns what we call jaundice, which means yellow. And melena would be dark colored tarry stool, usually caused by old blood. And nausea is feeling sick to the stomach. Steatorrhea would be where you have feces that has fat in it, so often you can see that. And sublingual is under the tongue. This is a person that has ascites, so this is the rich fluid, protein-rich fluid in the abdomen or the peritoneal cavity, and we would do a paracentesis, a needle to remove that fluid. This is icterus, where you can see that patient's skin and their sclera, their eye is yellow. Some other diagnostic terms: ankyloglossia is what we call tongue-tied, or a defect in that frenulum. It's too short, so the person talks differently. And then colitis is inflammation of the lip. Some people say cheilitis, but it's colitis. Esophageal varices are swollen, twisted veins in the esophagus, and it is a cause of what we call portal hypertension, where the liver's not working like it should, and too much pressure is building up. And that pressure causes those veins to get distorted, and they can rupture and bleed. Esophagitis is inflammation of the esophagus, as gastritis, inflammation of the stomach. GERD refers to gastroesophageal reflux disease. So a lot of people have this, where you have the backflow of contents in the stomach go into the esophagus and causes burning and sometimes coughing when you're sleeping. Gingivitis, inflammation of your gums. Glossitis, inflammation of the tongue. Parotiditis is inflammation of the parotid glands, also called mumps or parotitis. PUD is peptic ulcer disease. So it's a sore on the mucosal lining of the stomach. It could be on the duodenum as well. And we often see it related to what we call H. pylori, the Helicobacter pylori bacteria. Pepto means to digest. So that's something that's treated. So we often find that during esophagoscopy. So if they do a scope and look down there. And they can also see other types of ulcers, like gastric ulcers and duodenal ulcers. The pyloric stenosis would be a narrowing of that pylorus. Sinuloadenitis, inflammation of the salivary gland. Stomatitis, inflammation of the mouth. Anal fistula is where you have, fistula means you have like an area, they call it means pipe, but it's an area going into one area that it shouldn't be. So abnormal tube-like passageway from the anus that might connect to the rectum. So you're going to have stool going in a different place than it should. Appendicitis, inflammation of the appendix, and colitis, inflammation of the colon. And then you might have more specific, like ulcerative colitis, where they have chronic inflammation of the colon with ulcerations. Here's PUD, peptic ulcer disease. You can see that mucosal lining, they have these little ulcerations on there. And those little ulcerations can be irritated enough to bleed, and that person can, what we say, bleed out or lose a lot of blood and need a blood transfusion or even bleed to death. Here's an anal fistula, so where you have the, you can see the anus coming down, and then it has a little area that is going to an area where it shouldn't. So it has a little opening there. So that's the fistula. Other diagnostic terms, colorectal polyps. These are benign little tissue growths on the mucosal lining, usually in the large intestine and rectum, but they can be what we call precancerous. So polyp is polyp that is projected on a stalk. So pedo is foot, and then so a pedunculated polyp, and then sessile polyp would be a polyp laying flat on the surface. So we see different kinds. Diverticulum is kind of the exact opposite of a polyp. Instead of, like, a polyp would be like a little pocket that's formed, tissue growth, and this is a normal side pocket in the GI tract. So instead of, if you're inside the tract looking, instead of seeing a little bulging, you're going to see an indentation. So it's bulging on the outside. And then it's often said to be associated with low dietary fiber intake, but other people get it. We're not sure why. Dysentery would be inflammation of the GI tract by frequent bloody stools, most often from bacteria or protozoa, which would be some kind of like an amoebic, so bugs, if you will. And enteritis would be inflammation of the small intestine. Hemorrhoid is a swollen, twisted vein in the anal region. Hemorrhosis is a vein likely to bleed. So they get herniated, it's protruding, and then they can rupture. Hernia means protrusion of an organ part from its normal location. So if you like have a hiatal hernia, it's part of the stomach, goes upward or through the opening in the diaphragm, so an area going into another. Inguinal hernia, you also have where the intestine or the testicles will go into an area that it's not supposed to be, usually some kind of pressure or tear in a tissue lining. Ileitis would be where you have inflammation of the lower part of the small intestine. Peritonitis, inflammation of the peritoneum. Proctitis, inflammation of the rectum and anus. Cholangitis, that's where we're going to have inflammation of the bile ducts. And then cholecystitis, inflammation of the gallbladder. Choledocholithiasis, so this is the gallbladder and the common bile ducts containing stones. So choledocholithiasis. Cirrhosis is a condition that has, in the liver, has degeneration of the tissue, most often caused by alcohol or nutritional deficiency. Hepatitis, inflammation of the liver, which sometimes it's from hepatitis A, B, or C. A is from contaminated food or feces to the mouth, and B and C are blood and body fluid related. And pancreatitis is inflammation of the pancreas, which could be from several reasons, and alcohol being one of them. So diverticulitis, you can see here the polyps are on the outside, so we don't call them polyps, because when you're on the inside, you see the little pockets there, where it would be the other way around with the polyps. Intussusception means going into one and going into another, so that you can see the cross section of the intussusception. So one part of the intestines protruding or intersecting into the other. So then that's going to cause what we call bowel obstruction. There's common hernias or the hiatal hernia. So you'll see that's esophageal and stomach area there. There's protrusion there at the distal esophagus. Inguinal hernia, you can see the intestine going down to the scrotal area, and then direct inguinal hernia right across from it. You can see it there as well. So then you can get a blockage or what we call torsion, twisted intestines there. A volvulus is torsion, it's twisting of the intestine. Some people, their peritoneal cavity doesn't really hold their intestine. This place a little bit looser, or it's longer, and it has a ability to twist like that and cause a bowel obstruction. Some tests that we do or see, biopsy would be taking a piece of the tissue and sending it for a pathological exam. Endoscopy is looking inside some type of body cavity with a flexible scope that can diagnose and treat certain conditions. So we could do like a biopsy, take a piece of tissue, and we could do irrigation and suction. And then certain types of scopes. So an EGD is esophagogastroduodenoscopy. So that means it goes down the esophagus, looks into the gastro and the duodeno. So that tells you how far it goes. So people say EGD because it's easier. So esophagogastroduodenoscopy. And then we have an ERCP, which is an endoscopic retrograde cholangiopancreatography. So that's where we're going to go in, and we are also going to go down the esophagus, but then we're going to take a right turn in the duodenum to go over to the common bile duct and try to get stones that are there. So sometimes that doesn't quite work, and the stones are too big to pull through. The magnetic resonance imaging, looking at the abdominal cavity and the organs. When we look at doing an upper GI series, it's x-ray the esophagus, stomach, and duodenum, but the patient's going to swallow some type of contrast, so it lights it up. So if you look over here at this x-ray, you saw that contrast lights up areas. So it can let us know if there's areas of obstruction, versus a lower GI where that we're looking at beyond the duodenum on down, and the person usually has barium enema, so you're given the contrast the opposite way. And then sonography would be using ultrasound, so it's our least invasive. And then CNS is a culture and sensitivity, taking a sample of something and looking to see what it grows out, bacteria-wise or fungal-wise. And what we call stool occult blood would be where we're looking to see if there's a presence of blood in the stool. And we often will do that ×3, because you can have one piece of stool that doesn't have blood, but another piece may. Liver biopsy, so if we need to do a test to see how well the liver is functioning, we can take a piece of tissue going in between the ribs and aspirate out a piece of tissue. When the patient has that done, they could be at risk for bleeding, so we have them lay on that side, so the right side with the pillow, or usually for up to 6 hours. There's a picture of the endoscopy, so there's a picture of the scope, and then kind of shows you the fiber optics on the inside the scope, and then it shows going down into different areas, like what gastritis looks like, what a colon polypectomy looks like, so they can do a lot of invasive procedures with that. This one has the dye going in, and you can see the rupture of a diverticuli. So inside the intestine, and then you can see how the contrast leaks out there. This one shows somebody have a foreign body. So this is probably just a, what we call a, you could look at this on a chest x-ray or a, what we call a KUB x-ray, but you can see there's a coin and there's a paper clip there. And then, I don't know if that's a coin or a pin, but you can see a straight line at the very top. Hiatal hernia, you can see that stenosis or that stricture there going on. So that person would have a lot of GERD because the food is not going all the way down, and they're going to have the backup of acid. There's sonography using ultrasound, so you can see how it lights up the stones there in the gallbladder. Some operative terms: abdominocentesis is puncture of the abdomen for aspiration of fluid, versus the paracentesis. This is where we're going to drain the fluid. So we're going to put like a liter jar and drain it, versus just tapping it to get a sample. We're draining a volume off. Anal fistulectomy, excision of an anal fistula. Anastomosis, this is where we're putting two ends back together. So often where somebody has their intestines separated for like a colostomy, we would re-anastomosis or put them back together. So union of two hollow vessels. Appendectomy, removing the appendix. Bariatric surgery, or now we call it gastric bypass. Bariatric pertaining to baros means weight, and iatric pertains to treatment. So it's reducing the volume that somebody can hold within their stomach to decrease their ability to eat as much. Chyloplasty is repair of the lip. Cholecystectomy, cholecystectomy would be excision of the gallbladder, so common for any kind of gallbladder disease. Colostomy, so remember this is different than the colonoscopy is looking, the colostomy is creating an opening in the colon through the abdominal wall to where that person would eliminate their stool now. So it would be like a abdominal anus. Esophagoplasty would be repair the esophagus. Gastrectomy is removal of part of the stomach or all the stomach. Gastric resection, kind of the same thing. Gastroenterostomy is formation of an artificial opening between the stomach and small intestine, and then often performed at the time of gastrectomy to route the food from the remainder of the stomach to the intestine. Sometimes if they have a perforated duodenal ulcer, they have to do that. Glossectomy is excision all or part of the tongue, which we see a lot with mouth cancers from tobacco. Ileostomy is where we're gonna create an opening in the ileum versus the colon. And then pancreatectomy would be excision of the pancreas, and polypectomy would be excision of polyps, and proctoplasty, repair the anus and rectum. Laparoscopy is where you're going to go in with a scope and you're going to view inside. So you can see here, the laparoscope goes in and it's looking. So at this time, we're not saying we're doing anything other than laparoscopically going in to look. So it's just an incision into the abdomen and you're taking a view. Some of the different colostomy sites, so it depends on where they go in, where the outside pouch would be. So if they're in the ascending colon, it's on the right side, transverse in the middle, descending on their left, and then sigmoid, left lower abdomen. And then the further down they go, so down to sigmoid, the output will be a firmer stool. So when you go up to ascending colostomy, their output's always going to be like a liquid. We have different terms that we use for therapeutic terms, like a gastric lavage is where we put a tube into the stomach and to use it for exam or treatment, but remove stuff that's in there, blood clots. So we're really washing it out. So you're putting a tube down, putting fluid down, washing it out, and suctioning back out. NG tube, nasogastric tube, we're putting the tube through the nose and the tip of it ends up in the stomach. And we could either suck stuff out or we could put stuff in like medication and food supplements. Some of our categories of medication, antacid would be a drug that neutralizes the stomach acid. An antiemetic is going to prevent nausea or prevent vomiting. Antispasmodic would decrease motility in the GI tract to help with spasms or diarrhea. And a cathartic would be, there's a T missing there, it should be cathartic, a drug that causes movement of the bowels or also called a laxative. And that's it for chapter 11.